Hello guys, and welcome back to my YouTube channel. This is your menopause sexologist, specialist, Black American lady doctor, Dr. Sonia Carruthers, and it is Thursday night. Time for us to answer your questions you submitted to us online. I am being accommodated by my beautiful daughter, Bria Carruthers, who has monitored the email channel. Come on over, Bria. She's monitored the email channel and she's got these questions written down and she's gonna read those questions out to me. I'm gonna do my best to answer them for you. All right, hit it, Bria.
All right, our first question. I can't tell if I am in menopause or perimenopause because I haven't had a full period this year, but have had some light periods sometimes and some spotting sometimes. Where am I?
Oh, that's a good question. You're perimenopausal, okay? As I said in the talks, menopause is when you've gone a full 12 months without a menstrual cycle, all right? One full calendar year. If you're having some spotting, or you're having some light bleeding, and it hasn't been a full year, you're perimenopausal. So perimenopause, you skip periods become heavier, become lighter, become scanty, perimenopause. You got to go one full year without a cycle of your menopause. And don't forget, if you are perimenopausal, having some type of bleeding going on, you can still get pregnant, all right? So hope they answered your question. Next question, please.
All right. What if I'm not the age of menopause, but have some symptoms like hot flashes and vaginal dryness? Can I get help for that?
Yep. The answer is yes. So here's the deal. Many females begin to experience menopausal symptoms prior to their final menstrual period. So I have a lot of patients who come in their early to mid 40s with vaginal dryness, hot flashes, night sweat, brain fog, all these symptoms, and still having regular periods every month actually. And yes, there are things we can do about that. We can mitigate those symptoms by either giving you some hormone replacement therapy, putting you back on birth control, giving you some natural products. So yes, to answer your question, yes, there are things we can do about that to mitigate those symptoms that you're experiencing while you're still perimenopausal, because as I said, we should have a good quality of life throughout this entire phase through menopause and beyond. All right, next question, please, ma'am.
How would I know if my irritation in my private area is a plaque or patchy skin? And is this a sign that menopause is coming?
Okay, so I'm going to answer the latter part of the question first. No, plaques or patchy skin in the vaginal area is not a sign that menopause is coming. It could be anything that's happening in that area. You got to get it checked out. And how do you know if you have it? Because you see it, hopefully. Get your partner to take a look for you. If you don't have somebody to take a look for you, get yourself a mirror and look down there. Every female should know how her body looks, okay? Get mirrors, check out every part of your body. So how would you know if things are normal or abnormal? And when you find something that's abnormal, you can go and tell your healthcare provider about it. So get yourself a mirror, get it checked, and know it's not a sign that menopause is coming. All right?
Okay. What lubricants and moisturizers do you recommend?
Okay. Good question. My go-tos. Good lubricant. This is what you use just prior to sex. Uberlube. U-B-E-R-L-U-B-E. Uberlube. You can find Uberlube at the novelty stores. You can find it online. It's an excellent lubricant. It's a little pricey, but it's well worth every dollar you spend for Uberlube. A good moisturizer I recommend is something called Luvena. Luvena is an excellent moisturizer. It's something you would apply to the vaginal canal every 3 nights like clockwork to help the moisture stay within the vaginal area. So those are my 2 go-tos.
Okay. Last question. I see you walking every morning and saying your weight hasn't changed. How do you stay motivated?
That's a good question. And you know what? Number one, I really enjoy walking. But the most important thing for me is to make sure that I try to maintain cardiovascular health, try to keep my bones healthy, try to keep my muscles kind of built up. I stay motivated because, I want to be able to walk until I can't anymore. I just want to stay healthy overall in general because I believe I deserve to be in the best health possible. And so, me exercising every morning. Weight may not be changing, but this is something that's good for me to do, and I'm going to keep doing it. And if the scale goes down, great. Doesn't go down, great. It's not going to deter me. So I'm still motivated because I know this is something that is healthy. All right. Any more questions?
That's it.
Okay. All right. So thank you, Bria, for helping me with these questions. Thank you for monitoring the email address, which is askmisspaul@menopausedoctor@gmail.com. I will come back to you guys on next week, Monday, Tuesday, Wednesday, with a different body area that's affected by menopause. I want you guys to be informed, stay informed, and have a great evening. You guys take care. God bless. Good night.
Night.